would like, first of all, I would like to thank Professor Alex for giving me the opportunity to come and share this high scientific event. Really, I'm so happy to be with you, and every session I get more useful benefits and more, too much knowledge. My talk today, the title is Predictive biomarkers of neurodevelopmental disorders with special reference to autism. Of course, normal development of the central nervous system depends on complex dynamic mechanisms with multiple spatial and temporal components during gestation. A neurodevelopmental disorder is an impairment of the growth and development of the central nervous system, and in our use, we can describe the neurodevelopmental disorder as abnormality of brain functions that affect emotion, learning ability, and memory. A dysregulated immune response accompanied by enhanced oxidative stress, abnormal mitochondrial metabolism, and impaired lipid metabolism represent the common molecular underpinning of certain neurodevelopmental disorders, among which is autism, as we will see together in this presentation. Of course, understanding and confirming the role of these pathways in the etiology of autism are important for the definition of pharmacological therapies able to ameliorate clinical symptoms, and of course of autism or other neurodevelopmental disorders. It is very important to understand what are the etiological factors and what are the mechanisms leads to autism. This could be through the identification of biomarkers, since biomarkers represent a fundamental medical advance that can lead to an improved understanding of disease pathogenesis and hold the potential to define diagnostic and prognostic endpoints. Because of the difficulties in assessing brain function in patients and objectively identifying neurological and cognitive or emotional symptoms, future application of biomarkers to neurodevelopmental disorders is extremely needed, critically needed. What is the difference between brain, if you are searching or screening for biomarkers for brain compared to any other organ? Of course, the brain anatomy is very complex. In many cases, the complexity of the brain itself presents a severe roadblock to identification of useful biomarkers. In most organs like liver, muscle, cells are more homogeneous in their phenotypes, transcriptomes, proteomes, and cellular interaction. But in the brain, transcriptomes, proteomes, morphological phenotypes, and interactive connections are highly complex. There are too many types of cells, and each has its own metabolic pathway. So the introduction of novel therapeutics is required for optimal neurodevelopmental disorders. In this regard, biomarker availability will contribute not only to the identification of novel drug targets, but to the drug development up to the recorded biomarkers. Of course, all of you know biomarkers, but just to refresh your attention, biomarker is a physical sign or genetic measurement that occurs in association with a pathological process and that has diagnostic or prognostic utility. There are many intended use of biomarkers. It could be diagnosis for symptoms patients, early detection, as we were discussing yesterday, to help the early intervention and maybe stop the clinical presentation of the disease, monitoring of the disease, it means during therapy, risk assessment leading to preventive intervention for those at sufficient risk, they are expecting to develop the disease, prognosis, which which help for more or less aggressive therapy. If the patient could be treated with low dose, while we get high dose. Prediction, to predict the safety of drugs or treatments. Of course, the last three could help to predict the future. Here we are comparing, trying to compare between predictive and prognostic biomarkers. We can bypass this. What are the characteristics of biomarkers? Biomarkers must have many criteria like accuracy, precision, reproducibility, an estimated rate of false positive and false negative, probability, practicality, and simplicity to be used practically. Now let us go to brain biomarkers of brain disease. In case of brain disease, it becomes clear that it's not one biomarker. As we said before, because of the anatomy of brain is highly complex, we cannot use only one or two biomarkers. It must be a multiple or panel of markers or metabolites. This may provide better insight into disease diagnosis. What are the most important sources or body fluid we can use for detecting biomarkers? Of course, the cerebrospinal fluid, which circulates within the central nervous system. It is essential physiological rule for the homeostasis of the neuronal cells. It could be easily used to detect biomarker, or it is a very good source for detecting brain biomarkers. Because the change in cerebrospinal fluid composition depends on blood as well as physiological and pathological process. So cerebrospinal fluid is a perfect body fluid to study brain biomarkers. But getting the cerebrospinal fluid is not that easy. It needs a highly professional personnel, and it is also invasive. So let us ask ourselves, is the plasma a suitable body fluid to measure brain biomarkers? The answer is yes. If we know that about 500 ml of cerebrospinal fluid is absorbed daily into the blood, this could make the blood a suitable source for neurodevelopmental disease biomarkers. Here we can see the ideal biomarkers. It must be expressed as an increase or decrease, whatever the biomarker, in response to the increase of the disease, easily measured, not highly expensive, because if it is highly expensive, it could be used by many people. It should be correlate with the outcome or the progression of the disease. Biomarkers in autism, we recorded, as I said before, we recorded many biomarkers. Some are related to oxidative stress, others to neuroinflammation or autoimmunity. Now let us go to see biomarkers of oxidative stress. Really, there are two hypotheses relating peripheral oxidative stress to neurodevelopmental disorder or neurodegeneration. The first suggests that oxidative stress initially develops in the periphery, in the blood, with a variety of possible causes, and results in reduction of CNS antioxidants, finally leading to oxidative damage in the brain. It starts in the blood and then reflected on the brain. The second is that the central nervous system is the original place where oxidative stress begins, and then several different metabolic end products are formed and transported into the blood. Among the most important oxidative stress-related biomarkers we recorded is the redox ratio of reduced to oxidized glutathione or the glutathione status. It was found that this ratio was decreased by 52.8% in cerebellum and 60.8% in the cortex of autistic patients. suggesting glutathione redox imbalance in the brain of individuals with autism. And of course, this finding indicates that autism is associated with deficiency in glutathione antioxidant defects. But I want to pay your attention that glutathione alone could not be used as a predictive biomarker because many neurological disorders, all patients suffer from low reduced glutathione. But most important is the ratio. Usually, relative concentration of metabolite is much more important than absolute value. Recently, my student Yusra, she recorded elevated thyroxine reductase and the remarkable overexpression of peroxidoxins 1 and 3 in plasma of autistic patients. Then let us go to biomarkers of inflammation. Inflammatory cytokines including TNF-alpha, interferon gamma, interleukin, a set of interleukins were recorded to be elevated in serum and plasma of autistic subjects. While others, but this is not our work because we never work on brain, others were recorded in certain area of autistic brain. Which means that experimental as well as clinical evidence support the hypothesis that inflammatory process might be involved in the etiology of autism. These findings suggest that ongoing inflammatory responses may be linked to disturbances in behavior and require confirmation in larger replication studies. The characterization of immunological parameters in autistic or ASD has important implications for diagnosis and should be considered when designing a therapeutic strategies to treat these patients. Now, let us go to autoimmunity in autism. What are the recorded biomarkers? Really, it was found that autoimmune response in autism usually, what is already recorded that it is against altered self-protein, modified by adduction with lipid-derived electrophiles during the metabolism of isoprostane. IgG, IgA, IgM, anti-brain autoantibodies were present in high percentage of serum of autistic children, while protein adduct of iso4-levoglandin E2, who as end product or a product, intermediate product of isoprostane, was detected in certain brain area of autistic child, and this was done by Lu in that 207. It's not our study. In one of my recent master thesis, it was found that adenosine as an important modulator of the brain immune system could upset the balance between the pro-inflammatory and the anti-inflammatory cytokine, which is very important for normal brain development. Abu Schmitz et al., my student, recorded a dysfunction in normal adenosine homeostasis in autistic patients due to decreased activity of adenosine deaminase. And of course, lower adenosine deaminase might also be related to the increased levels of the pro-inflammatory interleukin 6 and tumor N-alpha and calcium and potassium. This was a summary of nitrogen metabolism related parameters we have measured in serum or I think in plasma of Saud autistic patients, and out of this we found that most important, as I said before, adenosine deaminase were much lower in autistic patients compared to control, but the most important thing is that they have low plasma GABA concentration, which is usually reflect a lower, they have high GABA concentration, which reflect a lower cerebral CNS concentration of GABA. And the most striking thing is that they have high glutamate-glutamine ratio. High glutamate-glutamine ratio, which I will explain in the coming slide. Individuals with autism are known to have increased level of serotonin. Now we are going to deal with neurotransmitters. It was found that autistic patients have increased level of serotonin in their blood, which may reflect the lower concentration of serotonin in the brain. Changes of level of serotonin don't seem to affect the symptom, but instead it targets certain behavior such as self-harm or withdrawal. It's related to self-harm or withdrawal. As I said before, gamma-aminobutyric acid was significantly higher in plasma compared to control, which means that lower brain GABA could be present. One strategy that serves to accompany the marked stratification of brain glutamate level is the glutamine cycle. As you see in the previous, we recorded higher glutamine ratio, which means high glutamate and low glutamine. This was studied, and it was found that glutamine cycle in the brain, which serves to control the levels of glutamate and to shuttle nitrogen between astrocyte and neurons, were affected in autistic patients. If they have higher glutamine ratio, it means that glutamine cycle between astrocytes and the neurons are highly affected. This was supported with recorded inhibition of GABA catabolic enzymes with divalprox as an effective drug in treating boys with autism. This which support our study. When patients with autism were treated with divalprox, they were improved, the impulsive and aggressive behavior were improved with a great percentage. So, recent evidence suggests that before the expression of behavioral symptoms and around the end of the first year, measures of brain function distinguish infants at high risk of autism. This could be used as a preventive strategy. These findings have been valuable in identifying the biochemical correlates of early functional brain development in this risk group and has inspired the hope of translating these findings into predictive biomarkers of the condition. Of course, in order to confirm our clinical study, we have to work on animal model of autism in order to work on the brain, to see what is going on the brain if we induce autistic features. If we record a bunch of biomarkers, you have to measure what is more sensitive and specific. This is usually done by receiver operating characteristic curve, which measure the specificity and sensitivity of the biomarkers. The more area under the curve, the more specific. And now I start to think, I went back to all my recorded and already published biomarkers and start to ask my physician to draw the predictiveness curve to know which is predictive biomarker and which is not. This is as you see, this is the predictiveness curve. Here you can see a poor biomarker. If the biomarker predictiveness curve is like this, it means it could not be used as a predictive biomarker. But if it is like this, it means that it could be a perfect predictive biomarker. Here's some of my published work when I draw the predictive biomarkers. As you see, most like here. This one is excellent, thioredoxin. It is an excellent predictive biomarker. But I want to pay your attention to that two decide if the biomarker is predictive or not, it could be or it must be related to the prevalence of the disease. It must be related to the prevalence of the disease. So, if we conclude, our conclusion is that identifying the correlates or biochemical correlates of early functional brain development in autism would have inspired the hope of translating these findings into predictive biomarkers. Given the goal of prevention, it is necessary to study children at age too young for clinical presentation, which could help to record a panel of predictive biomarkers and diagnose a pre-symptomatic autism. Most important, which I want to pay your attention in this talk, is that accurate measure of prevalence of autism in different populations is critically important for the proper use of predictive biomarkers in prevention strategy. Thanks a lot.
Thank you very much. We continue to round table discussion. Теперь